Now, next week, the government will seek to renew its emergency COVID powers for another 6 months, even though the vaccine rollout continues on target, hospitalizations and deaths are collapsing, and in 3 months, the final COVID restrictions are expected to go in England. So why the need for emergency powers through to the autumn? I'll be speaking shortly to Jonathan Sumption, but first, let's go to Kate Andrews, our economics correspondent. She edits the Spectator's daily lunchtime briefing, which contains all that you need to know about each day's latest COVID news. Kate, over to you.
Thanks, Andrew. As you say, MPs are set to debate and extend the emergency powers before the Easter break. And this has prompted a deep dive into the data to look at how we're really tackling COVID-19 in the UK at the moment. As you can see from this first slide, the 7-day average for infections has been on a steady decline, now sitting around where infections were in early to mid-September last year. And here in the second slide, you can see that hospitalizations are on an even steeper decline. And this is looking at the number of patients admitted to hospital, which is now down to where it was in early October. And this has certainly been helped by the vaccine rollout, which is preventing not just against catching COVID-19, but of course serious reactions to the virus, which can lead to hospitalization. And sadly, death. Although if we look at this third chart here, deaths again clearly in a steady decline as well, with the 7-day average now reflecting where we were in early to mid-October last year as well. Now, sadly, this is not the story that is reflected everywhere else. The UK, as you can see from this next chart, has one of the lowest case rates in Europe. This week, Italy put much of the country back into red zones, a very restrictive form of lockdown as another wave hits. France is expected to extend lockdown measures into the Paris region in the days to come. And the Czech Republic has even been relying on the hospital capacity of other countries to treat their patients. Now, much of what is behind this is Europe's struggle with their vaccine rollout. And you can see from this last slide that the UK continues not just to be a leader in Europe, but a leader worldwide when it comes to this jab race. There were worrying indications yesterday that we may be looking at a slowdown of our vaccine rate in the month ahead, a reminder that the story is far from over. But when we're debating the extraordinary government powers, you can see how one could certainly make the case that parts of Europe are experiencing a state of emergency, but that argument is becoming much more difficult to make here in the UK, at least right now. Back to you, Andrew.
Thanks, Kate. It's kind of a striking graph there of between Britain and the rest of the other European Union countries. Tell us a bit more, if you can, about this AstraZeneca vaccine shortage, if it is a vaccine shortage. Some sort of scare stories in the London papers this morning.
I think in short, Andrew, yes, it is a bit worrying. We got this leaked letter yesterday from NHS England to local vaccine suppliers saying that they were expecting supply to be more limited in the month ahead. It's thought that part of the reason for this is a delay in getting roughly 5 million doses of AstraZeneca from India, that there's been a delay on the export from India, which is disappointing news, especially for those who haven't had their first jab yet, because in this letter it states that there should be a pause on offering people appointments to get their first jab. Although it's insistent if you've had your first jab, you shouldn't worry, your second one is still coming. Now, ministers have been quick to say that this is just part of the process, that the vaccine rollout is going to have its peaks and troughs and people shouldn't be worried. And they're also insistent that their deadlines they're sticking to when it comes to the top 9 most vulnerable categories of people being inoculated by the 15th of April, and then for all adults to have gotten their first jab by the end of July. But I do think this is an important reminder that while things are going so well, and as you saw in that chart about the vaccine race, the UK really is a world leader, the race is not over. We're still going, and there's still many hurdles that we have to overcome. So unfortunately, it looks like there could be a bit of a slowdown in April, but other vaccines are expected to come online in the spring. We don't have specific details yet, but we should be looking at the Moderna vaccine, hopefully in the near future, so things could pick up as well.
Well, there are a lot of European countries sitting on a huge batch of AstraZeneca vaccine that they say they don't want to use because they think it doesn't work very well. Can we not just get them to send over the stuff they don't want?
Yet this is becoming a bit of a circus in the European Union. For months now, you have had Ursula von der Leyen and you've had major European leaders undermining confidence in the AstraZeneca vaccine and indeed in the UK's rollout of vaccines full stop, suggesting that our nimble regulator perhaps skipped over some safety precautions for which there is absolutely no evidence. You had Germany, you had France suggesting, I think it was Macron said that the vaccine was quasi-effective for the over 65s. Again, no evidence for this. Now we're in a very strange position where many of these EU countries are on the one hand complaining that AstraZeneca hasn't been giving them the supplies that were promised, and they're in a rage about this, and then on the other hand suggesting that they have to pause this vaccine because they're not sure about the safety standards. What I would say in defense of the EU is that the European Medicines Agency is adamant that this vaccine is safe and that it should be administered to all of the adult age groups, and they're pleading with European countries to start up the rollout of AstraZeneca again if it's been paused. So in many cases it's not the EU, although there have been moments I think from leaders in the EU that have undermined this process, but individual European leaders. And it's frustrating because it seems political in many of these circumstances. It just seems like they're getting in line, following one after the next, following what their neighbors are doing, but it isn't necessarily in the best interest of the nations.
The problem is that even if the European medical authorities say it's okay, and everybody expects that that's exactly what they're going to do, I'm afraid Chancellor Merkel and President Macron have poisoned the well. Opinion polls in France, for example, show that there's a substantial minority of French people who just won't take AstraZeneca now. I mean, they will not find this easy, Kate, to roll back. They have already changed public opinion, and public opinion won't dance to their tune now. I think as Europe is hit by a third wave, as your figures show, this is a real crisis for Europe, I would suggest.
I fear deeply, Andrew, that people who are vulnerable to this virus, people who could end up in hospitalization, even sadly end up dead from this virus, may be put off getting the vaccine because of what these major European leaders have said. I think you're right. It's very hard to roll back now because it's not the first instance that they've done it. They've been doing it for months.